you said it too, but when I touch you, I feel like I'm cheating on you. I thought that I'd be better when I found someone new, but when I touch you, I feel like I'm cheating on you, baby.
Today I'm going to tell you about menstrual cycle. Roles of hormones in menstrual cycle. The menstrual cycle involves the production of a secondary oocyte and thickening of the endometrial wall throughout one cycle. The endometrium will become soft, thick, and rich with blood vessels. This is to prepare the endometrium for embryo implantation. If fertilization does not happen, the secondary oocyte will die and the endometrium wall will shed. This will lead to bleeding known as menstruation. Gland pituitary, which consisted of follicle stimulating hormone, or known as FSH. This hormone functions to stimulate follicle growth in the ovary. It also stimulates the release of estrogen. Pituitary gland also secretes luteinizing hormone, which functions to stimulate ovulation, cause the formation of the corpus luteum, and stimulates the release of progesterone. The ovary, in the other hand, secretes estrogen. Estrogen repairs and stimulates the thickening of the endometrium. Estrogen also stimulates follicle growth until it matures. It also stimulates FSH and LH release prior to ovulation. Progesterone is also secreted by ovary. Progesterone stimulates the thickening of the endometrium, making it thick, folded, and rich in blood vessels to prepare for the implantation of an embryo. The progesterone also stops the release of FSH and LH to prevent follicle growth and ovulation. That's all from me. Thank you.
So first, we will go to menstrual cycle day 0 sampai day 5. Before a menstrual cycle begin, all level of hormones are low. So with the absence of progesterone hormone and estrogen hormone, the thickened endometrium will shed, and so menstruation begin. Menstrual cycle ni actually begin one day before menstruation. That is when a part in brain called hypothalamus release a hormone named GnRH. GnRH stimulate the pituitary gland, another part in brain, to secrete more FSH and LH. FSH will stimulate follicle growth. Within the primary follicle, there is an oocyte that will grow into a secondary oocyte, which is contained in the Xtrovian follicle. In the follicle development, there is a development of primary follicle and development of secondary follicle. The change or the growth will release estrogen, and as we know, the estrogen will encourage endometrial wall repair, and it will encourage follicle maturation. At this point, the level of estrogen is still low. Low level of estrogen will inhibit the release of FSH and LH via a negative feedback mechanism to prevent another growing follicle. Next, we will go to day 6 until day 14. The level of estrogen will rise and peak at day 12, which will stimulate hypothalamus in our brain to secrete more and more GnRH. More GnRH means more FSH and more LH. The LH level will rise and peak at day 13, leading to ovulation. On day 14, it will lead to the release of a secondary oocyte from the Graafian follicle. LH will also stimulate the follicular tissue remain and transform it into a corpus luteum.
Day 15 until 21, the LH will stimulate the corpus luteum and secrete the estrogen and progesterone. After that, the combination of estrogen and progesterone will inhibit the release of FSH and LH from the hypothalamus via negative feedback and stop the growth of new follicles. From day 22 until 28, if the fertilization occurs, the corpus luteum will continue to grow and secrete the estrogen and progesterone. This will cause endometrial wall to continually thicken to support the further growth. But if the fertilization does not take place, the LH level will decreasing and will cause the corpus luteum to degenerate, and the secretion of estrogen and progesterone will stop. Without estrogen and progesterone, the endometrial wall will shed and the menstrual cycle process will begin.
Lastly, I will explain about the role of hormones in miscarriage and pregnancy. During early pregnancy, the corpus luteum will continue to secrete the progesterone to maintain the thickness of the endometrium. Progesterone inhibits the secretion of FSH and LH and stops the menstrual cycle and ovulation during pregnancy. When the placenta is formed, the corpus luteum will degenerate and will stop producing. Next is miscarriage. Miscarriage is caused by a lack of progesterone. The thickness of the endometrium is reduced and the embryo cannot be embedded secretly in the. Last one is premenstrual syndrome and menopausal syndrome. These two are due to hormone imbalance. For premenstrual syndrome, it also occurs in the week before the menstruation due to the changes in estrogen and progesterone levels before menstruation. It also affects a woman emotionally, physically, and mentally. For the mental symptoms, it could be tension, confusion, anxiety, depression, or mood swings. For the physical symptoms, it could be abdominal pain, headaches, or breast tenderness. Last one is menopause. Menopause, it occurs at the age between 45 to 55 when the menstruation stops. The ovaries become inactive and it will stop producing ovum. Less estrogen and progesterone are produced. The symptoms are sleeping disorder, hair loss, weight gain, and mood swings, and many more things. That's all from us. Thank you.
Stay safe at home. Kita jaga kita.